Irritable bowel syndrome, or IBS, is a common digestive disorder. It affects the large intestine. People with IBS often have stomach pain and changes in bowel habits. It can cause diarrhea, constipation, or even both. IBS is a long-term condition that needs to be managed over time. IBS is not the same as inflammatory bowel disease, or IBD. It does not cause changes in bowel tissue or increase the risk of colorectal cancer. However, it can be very uncomfortable and affect daily life. It is important to understand IBS to manage it effectively. Doctors do not know exactly what causes IBS. There is no cure, but symptoms can be controlled. Managing IBS involves understanding the condition and making lifestyle changes. Knowing the types and causes is the first step. IBS comes in 4 types, each with unique symptoms. IBS-C means constipation, hard, lumpy stools, and fewer bowel movements. IBS-D is diarrhea, frequent loose stools and urgency. IBS-M is mixed, both constipation and diarrhea. Unclassified IBS doesn't fit the other types. Knowing your type helps guide treatment. The exact causes of IBS are not well understood. However, several factors can contribute. One possible cause is abnormal muscle contractions in the intestine. Stronger or longer contractions can lead to gas, bloating, and diarrhea. Another factor is the nervous system. Problems with the nerves in the digestive system can cause discomfort when the abdomen stretches. Stress and anxiety can also worsen these nerve issues. Managing stress is important for people with IBS. Some people develop IBS after severe gastroenteritis. This condition is called post-infectious IBS. Changes in gut bacteria known as the microbiome may also play a role. An imbalance of good and bad bacteria can lead to symptoms. Food sensitivities or allergies can trigger IBS symptoms. Common triggers include dairy, gluten, and certain fruits. Identifying and avoiding triggers can be key in managing IBS. IBS causes a range of symptoms that can vary in intensity. Common signs include abdominal pain, cramping, bloating, and gas. Pain often improves after a bowel movement. Changes in bowel habits like diarrhea, constipation, or both are typical. People may feel urgency, or that they haven't fully emptied their bowels. IBS can also affect emotional health, making stress management important. Treating IBS involves a combination of medicine and lifestyle changes. No one-size-fits-all treatment exists. Doctors often recommend dietary changes first. Avoiding trigger foods like caffeine, alcohol, and certain carbohydrates can help. Fiber supplements can alleviate constipation. They help to bulk up stool and make bowel movements easier. For diarrhea, doctors might suggest loperamide, a medicine that slows bowel movements. Antispasmodic medicines can reduce cramping and pain. Probiotics may improve symptoms by balancing gut bacteria. They are available in foods like yogurt or as supplements. Stress management techniques, such as meditation or yoga, can also be beneficial. Regular exercise and adequate sleep are important. They improve overall health and reduce stress. Keeping a symptom diary can help identify triggers and effective treatments. Certain foods can help manage IBS symptoms. High-fiber foods like fruits, vegetables, and whole grains can ease constipation. However, it is important to increase fiber intake gradually to avoid worsening symptoms. Low FODMAP foods are recommended for many IBS sufferers. FODMAPs are types of carbohydrates that can be hard to digest. Foods low in FODMAP include bananas, carrots, and spinach. These foods can reduce bloating and gas. Ginger is a natural remedy for nausea and digestion. Adding ginger to meals or drinking ginger tea can be soothing. Peppermint oil is another natural option for reducing cramps and bloating. Hydration is key. Drinking plenty of water helps maintain regular bowel movements. Avoiding large meals and eating small, frequent meals can also help manage symptoms. Living with IBS can be challenging, but support is available. Joining a support group can provide comfort and advice. Sharing experiences with others who understand can reduce feelings of isolation. It is important to communicate with healthcare providers. Regular checkups can help monitor symptoms and adjust treatments as needed. Being open about challenges can lead to better management strategies. Remember that IBS is a manageable condition. With the right approach, many people lead full and active lives. Patience and persistence are key in finding what works best. Maintaining a positive outlook and focusing on overall well-being can make a big difference. Encouragement and support from loved ones are invaluable.